All right, so welcome everyone. Thank you for those of you who helped me with my audio test. Greatly appreciated. Although there may be other folks coming in as we get started, out of respect for everyone's time today, I did want to begin the webinar. So my name is Kate Quigley. I'm the Lead Resource Specialist and Project Manager in the 211 Information Services Department here at the United Way of Connecticut 211. I'm happy to share this information with all of you today, and I appreciate your time. I would also like to thank our partners at CHN and DSS for their support in this effort to bring you information via lunchtime webinars in this series that we have been rolling out over the last few months. Just a little bit of housekeeping. We are going to keep the session today to a half an hour. So again, to respect everyone's time, we will have a hard stop at 12:30. But I will save a few moments at the end of the webinar for questions. Because the webinar is in a listen-only mode, we will be taking those questions via the chat in the software. So at the end, I will save time. I will open it to questions that you can chat, and I will then verbally answer for the whole group of participants to hear. Okay, so what I'm going to do today in the next half an hour is provide a brief overview of our services here at 211, but the bulk of the presentation will be a live demo of our website, and we'll be looking at resources related to nutrition, education, wellness programs, food resources that hopefully will be of use to you in the work that you're doing out in the communities with your clients and families every day. So for those of you who are not familiar, 211 is the statewide information and referral service for Connecticut. We are open 24 hours a day, 7 days a week. We provide information to residents on various programs and services. We also take a role in crisis intervention and suicide prevention, both for youth, adolescents, and adults. Excuse me. But the information that our contact center accesses every day internally, almost all of the resources are available on our public website, so our 211ct.org website. We recently have made great enhancements to the website. The process began in August of 2015, and we just recently wrapped up all of the new features this summer. So it took about a year, but we are in good shape for offering a lot more useful tools and means to search the website, which I'm going to put into motion momentarily. And after the webinar today, if you have questions about 211 in general, but more specifically about how to use the website to find what you need, I am going to put up a quick page of my contact information, which I'll show again at the end of the webinar, but please don't hesitate to reach out by phone, by email. I'm happy to walk people through the website if that's something that you feel is necessary in your work, because we want providers, especially case managers, anyone in the health and human service field, to be able to use our site as a tool to, again, look up information and resources for the clients that you are serving. Okay, so I'll put this slide back up at the end of the presentation as well if anyone comes in late. And we are going to get started with our demonstration. So here is our newly revised website. Some of you may have been used to older versions of the site. This is the newest version here. So if you have materials that have old photographs on them, just know that the site remains the same, www.211ct.org. There are various ways to search our website. I will jump into those in a moment, but before we start that, I did just want to show you a few of our specialized services that may be of interest to you in your work. The first is our Child Development Info Line, or our Birth to 3 unit. Child Development Info Line handles calls through their own call center here at the United Way of Connecticut. They take calls 9 a.m. to 6 p.m. Monday through Friday. But they also have a very new and amazing website where providers and families themselves can come to find information about concerns with the pregnancy, concerns about delays in a child's development. All of the programs that CGI works with is available here. For more information, providers have specific means of making referrals into the program. For the sake of time, I cannot dedicate too much to going into this site, but I want you to know that it is here off the home page of 211ct.org, and that as a provider, you can make referrals into this program very easily through their website. So I empower you to use that. The other department that may be of interest to you when you're working with families is our child care unit. So this is 211 Child Care, another program under the umbrella of United Way of Connecticut. They offer information and referrals on daycare providers in the state of Connecticut, both licensed centers and licensed home providers of daycare. So you can search their database of resources if you know someone who wants to open a child care center, perhaps. There's a lot of training materials on the site. So again, this is available off our homepage, the link to their site. They take calls in their call center here 8 a.m. to 5, Monday through Friday. So just know that if you have time and you want to look at more information, those two options are available to you. So I'm going to start right into our search page here. There are 3 ways to look up information on our public website. One is really a free text box here where you can start typing in a word or a phrase or a name of a program or an agency. I'll show you that feature in a moment. The second option is our help statement. So unsure of what you're looking for, let us help. If you click that box, you'll get a drop down. And these are really need statements based on situations and scenarios that come into our call center. So this is how folks really present themselves to us when they call. I need food. I need health insurance. My utilities are going to be shut off. So for someone who may not be familiar with all of the resources that we may have and how to look them up, our intention for this is to really have it be a user-friendly and more common language option for people to search the site. Okay? The other way to search is through our categories. So here is just a real brief snapshot of some of our categories. I'm going to click on More Categories so that you can see the full scope of how we break out some of these resources. For the sake of this demo, I'm going to start with children and families. And as we see, we have a few options here for resource links back into our database. I'm going to focus here on child nutrition for the sake of this webinar today. Please know, though, anytime you come to a category, this is not an exhaustive list. This is just a slice of the database, a snapshot of some of the resources within these categories to really get people started, but it's not the full list of options that may fall under any one of these categories. So I'm going to search school meals for child nutrition. What you'll see is that it brings us to the results page of our website. School meals is populated. The default, if you don't put in any geographic filter, is Connecticut. So this is a statewide look at resources, 151 to be exact, that provide school meals. And they're generally linking up with the public school system. So let's say you're working with a family in Bridgeport. If you just type in Bridgeport and click search, it will re-up the list. So now we have it narrowed to 3 results. Again, mainly pointing back to the public school system, a few other options as well. But let's say you're working with a family and their child does attend the Bridgeport public school system. If you need more details about this resource, you can click the More Details button. It will expand the information for you to tell you the address, the phone number, a few more pieces of information, the website. But the nice thing about our website now is that you can start to build up a resource cart so that you can come up with a very comprehensive list of options for whomever you may be working with. So I'm going to jump right into that feature here and click Add to Cart. When I do that, you see the resource cart here at the bottom starts becoming populated with one option. What I'd like to show you now is the free text box, which is both available on the home page, but then on the results page here. Let's say the family you're working with needs food, and they need food sooner rather than later. So if you start typing in the word food, you'll see a few options come up. What we're going to choose here is food pantries, and click search, keeping this list isolated to Bridgeport. You see that 41 resources come up. You'll see all the pins on the map correspond to every resource card on the left here on this list. What I would like to show you is some advanced filtering. So let's say 41 resources is too many to weed through. You only have a few moments with this family. If you click this button, Show Advanced Filters, it will drop down options for you to narrow your results. So for food pantries, let's say this family can only access food on a Thursday. If you click Thursday and filter results, we'll see that the list went from 41 to 14 resources, a much more manageable list of options. So let's say that the family lives close to this particular organization and they are interested in that pantry. You can add that to the cart. And the same for, let's say, Salvation Army, adding that into the cart. So now we have 3 resources in our cart. But let's say that the family also has a young infant who they may need formula for. I'd like to draw your attention to these terms here. You may also be interested in. These are our recognized terms behind the scenes for additional resources that are related to what you searched. So let's say the family does need formula. You can click here. It's going to re-up the entire search, still keeping Bridgeport. We see 2 resources. One is local to Bridgeport. The other serves the entire state and is a bit farther away. The system will tell you how far away resources are from the town that you plugged in. So this particular resource looks like a good option. We're going to add that to the cart as well. Okay? So very quick and easy access to information right at your fingertips. I'm going to show you what the cart looks like, and then I'm going to show you a few other options and ways to search and share the information. So we have your cart. At any point you can remove a resource from the cart if it no longer applies or the family decides that they don't want that option. We have the full list here. What you can do at this point is print or share this entire resource cart. So if a family or a client wants this on paper, this list of resources, you can print it out for them. Simple click of the print button here. Or you can send them an email. And within the email, you can type in comments like, don't forget to visit the food pantry. As soon as you hit send and plug in their email address, it goes right to them. So this is a nice way for people to stay organized and get just the information that they may need at that point in time. My only guidance and caution is that this resource cart is a single session use. So what that means is if I closed out of this browser right now, the cart goes away. We're all used to shopping carts on Amazon and things on the web where sometimes those carts hold and then the next time you go back in it's still there. That is not the case currently with our site. So the recommendation really is to keep the browser open and just change the search as often as you may need to in a day's time. Or once you have the cart, doing something with it, either printing or emailing it so that it's a point-in-time account of the information that you were looking up. Okay, so the other thing I would just like to show you on the search page here, and we'll use the search that we already populated. If you were on a cell phone or a tablet, you could, on your phone, do a quick click to call this particular resource, to view their website, or to get directions. So the directions functionality is powered by Google. It'll allow for driving directions, transit, walking, biking. It does work really well. It'll preset the directions to this particular address, and then you just plug in where you're starting the journey from. But the entire 211ct.org site is mobile friendly and location aware. So if you try this on your cell phone later, it may ask you that it wants to track your location. You can deny that, or you can allow it, and it'll isolate the resources that are closest to the location that you provide. The other option that I would like to bring your attention to is up here at the top right. This is both on this results page here and on the home page, is a translation feature. This is also powered by Google Translate. You can translate this site into any one of these languages here. I will show you what that looks like. So we translated it into simplified Chinese, and you'll see almost everything, aside from the map because that's separate, will be translated. So if you have families and clients whose primary language is not English, this may be a very useful tool so that they can navigate the site in whatever language might feel most comfortable for them. So, excuse me, to get back into English, up at the top here it'll say Show Original, and when you click that, it's going to bring you right back into English. Okay, so I'm going to put this search aside and we're going to go back to the home page. You will see that it'll populate whatever you had previously searched. So if we clear this out, the default for resources is Connecticut, as I mentioned before. I do just want to give you a few quick tips and terms that may be of use related to nutrition and nutrition education. So if we look up the word nutrition, you'll see there are nutrition education options here. I am going to keep the search open to statewide options so you can see the scope of what we have in the database. Currently in our database, we have about 4,100 agencies and about 47,000 services and programs statewide. So we have a lot in there, but to be able to narrow it down to what you need with some of these new filters and functionality is really the hope that we have, that everyone will be able to find what they need. So nutrition education comes up, 34 resources. If we click on one of the pins, and I'll just show you, it's going to drop you right down to the actual resource card that corresponds to that pin. And from here again, you can also, if you were on the phone, call, view website, or get directions. I'm going to scroll back up to the top. As we mentioned before, that you may also be interested in terms. Another one that you can choose is wellness programs. It'll change the search here. We have 81 resources statewide for that. And again, if you're researching for yourself or a family, all you'd have to do is change the geographic filter to either a city, as we already looked at, a specific zip code, or you can even type in an address of a location, and it will narrow the results by that means as well. Other terminology that may be useful to you around weight loss, we type in the word weight. We're going to get weight loss assistance and weight-related support groups. So we'll just take a quick glance as to what those resources look like. And let's say you wanted to use other filters as well, just to show you what else is available. We use the day of the week filter for the food pantries. You can narrow results by serving males only, females only. You can narrow results by age group, and whether or not a resource is open now or not. So just remembering that those are available and use them as you see fit. The other option here, we type in the word health. There's a lot of options for health, but we're looking for, we have health screening services, pardon the scrolling. We have health/disability related support groups. So a lot of these would relate to staying healthy and staying well. We have a fair amount of these, usually linked to hospitals and community health centers, but please know that these are available to research as needed. Okay, the other options in terms of emergency food, I'm going to go back to our home page and to our categories really quickly. We're going to look at the food category. We showed food pantries, but the other options that may come into play, soup kitchens where someone can go to get a hot meal, grocery delivery resources, formula we looked at, food stamp SNAP, that's the program that folks can apply for with the local Department of Social Services. And then other options, farmers markets. There are some farmers markets that run year-round during the winter, obviously more so in the summertime. There are meal sites during the holidays that we're starting to populate. And then here, under suggested reading, I'd like to show you one of our e-library papers. So the e-library papers are related to certain programs or topics. They were created a long time ago for use by our call center staff in 211, and they are continually maintained currently in our Information Services Department. We have over 400 of these papers. They can be printed, they can be linked to. Basically, it'll give you a snapshot of information about this one in particular, WIC, Women, Infants, and Children program. It'll give you the program description, what the eligibility for the program is, so you can talk with your families and clients about WIC. And then if you scroll down to the bottom, it will always generally link back to the list of resources that we have coded for WIC in the 211 database. So again, trying to make this resource search accessible and easy and right at your fingertips. The e-library itself is a tab off of the home page and the results page. You can browse the e-library when you have some time. Again, there are over 400, but a lot of resources under food, under children and families, under health issues, related to wellness, nutrition, education, and those types of resources. Okay, for the sake of time, I'm going to pause for just a moment. I'm going to go back into the software, and if anyone has a question about what I just covered or something that maybe I did not have time to get to, I'm going to empower you now to go ahead and type that into the software, and hopefully we have a question or two for the last 5 minutes, and I will happily answer any question you may have. So I'm going to pause and take a quick second for you to ask a question if you have one. Okay. Okay, so it looks like no questions at the moment, which is absolutely fine. I will put up my contact information again for anyone who may have come in late. I am Kate Quigley with United Way 211 Information Services. Please feel free to contact me by email or phone if you have questions about what we covered this afternoon in the webinar, or when you're on the website independently searching and you may hit a roadblock and you have a question, please feel free to reach out. We're happy to assist with that. We want the site to be useful and a tool that people can use every day when they're working with their families and clients. So I'm going to go back to the website one more time, and I'm just going to bring your attention to one other way that people can get a hold of us in terms of resources. If we do a search here, let's say for soup kitchens, and let's say you're working with someone and you realize that the information that we have here for any particular entry, it might be wrong. Someone may have gone down to the soup kitchen and the door was locked and they told you this, or you yourself, through community channels realize that we may have wrong information, there is a way to report an update to us via the website. So any resource card that you land on, if you click more details, we'll have a report update button. If you click it, it's a very easy intake form, very basic information that we ask, and just tell us what is the issue, what do you need to report. That comes to my department. We act on those very quickly. And as we always say, we're only as good as the information that is given to us from community providers, people that are out in the world at these particular sites, and the agencies themselves updating with us. So just know that that's available as well. Again, 211 is available 24 hours a day, 7 days a week, and the website 211ct.org is available anytime from any device, phone, tablet, computer. We hope that this information has been useful for you today. And we will be offering a few more webinars within this series coming soon, so please stay tuned for that and check your inbox for future invitations. We really appreciate your time today. I thank you all for logging in and joining me this morning. I hope that you have a great day. I'm going to check the software one more time and see if anyone had a question. Nope. All right. So I'm going to close the webinar now. Again, contact me if needed. And again, thank you so much for your time. Have a great day.